Hello NCH friends, it's Paul Hild, CEO here at NCH. We're fortunate to have excellent physicians on staff here at NCH and in our community. And I can tell you they're here to help you. They're in touch every day with the CDC and following closely the guidelines from federal, state, and local healthcare agencies.
First thing I tell my patients is don't panic. Remember SARS, remember MERS, remember Zika, remember AIDS in the early days as well, remember anthrax. These are all threats that we had previously that we survived. And I think we will be able to survive this as well too. So COVID-19 actually is a reference to the disease. So COVID is coronavirus, the D is disease, and 19 because it came about in 2019. So COVID-19 is a reference to the disease that the coronavirus causes. We have not seen this virus in humans before. So what that means is because we've never been exposed to it, we don't have immunity to it. We also don't have anything like a vaccine yet or any good treatment for it. So if someone were to get this disease, currently the way we would treat them is with supportive care. So the vast majority of people who get ill have a relatively mild form of the disease, but those that have more serious problems, we would treat them more intently. Wash your hands after you go to the bathroom, wash your hands before you eat, wash your hands if you've been in social settings, shaking people's hands. Soap and water is the best. If you don't have soap and water, those alcohol gels are great. They're a great substitute. And when you wash your hands, remember to wash the backs of your hands and wash in between your fingers. Sing happy birthday twice. Wearing a mask in public really doesn't help that much. Surgical masks that you see so many people wearing, they're actually made to stop the surgeon from coughing into the wound and contaminating it. So we use masks for people who are sick. We'll put a mask on them so they don't spread it. But in the interim, we just need to do what Mom taught us, wash your hands. That's what we really need to do. If someone were to call the office and have a fever, a cough, and any respiratory distress, they do meet the criteria for being tested for COVID-19. What I would recommend though is if you have a primary care doctor, that's a very good source of factual information. Call them. If you have questions, call them and talk to them about it. They'll be very helpful. NCH has a really good website that shows exactly what we're doing and how prepared we are to meet this challenge as we go forward. What I would tell people is keep this in perspective. This year in our country alone, we've had 34 million cases of flu in our country alone. There's been about 125,000 cases of COVID-19 in the whole world. This year in our country alone, 20 to 40,000 people have died from flu. There's been about 4,000 mortalities in the whole world from COVID-19. So we really need to keep this in perspective.